All right, I want to show you just a few things on the outside of the heart before we cut it open. So we want to have the heart oriented in this position. You can see this is the back of the heart. That would be towards the back. This is the front that's towards the front of the chest. You can see this little line right here that divides the heart. It's not symmetrical. The left side is larger than the right side, but this line that divides it is the coronary artery, and it has little branching arteries that feed the muscle of the heart. On the left side, it's a little bit firmer than on the right because that muscle, the myocardium, is thicker on the left side. If you look at the top right here, which is called the base of the heart, you can put your fingers in to these different vessels to reach down and fill into the chambers of the heart. So this vessel right here is the pulmonary artery that is leaving the right side of the heart to go and take blood to the lungs. Behind that, the thickest walled vessel right here is the aorta. And you can put your finger down through the aorta and get all the way down into the left ventricle right there. You can see some thinner ones. This is the superior vena cava. The vena cava, the walls are a lot thinner than those arteries that are leaving the heart because it's lower pressure when the blood's coming back. So to cut it open, we want to have it this way, and we want to cut on the left side so that it will open up into two pieces, the right side in the middle. So I'm going to use my scalpel. Be really careful with the scalpel. Start up here at the top and just start cutting through. It's kind of tough, and the scalpels aren't all super sharp, but we'll do our best. And just cut through on that left side of the heart to open it up. So once I get down to the point or the apex, I'm going to try prying a little. You need to go deeper. Just keep cutting until you can open that heart up and lay it flat and be able to see both sides. Don't cut your hand. Going through that aorta, it's pretty tough. So you have to kind of pry it apart while you're cutting. Get that opened up. A little bit farther this way. You'll see you get to a point. You don't want to cut it all the way in half, but like that so we can see it laying open. So I'm going to turn this around so you can see. So here is the left side of the heart. You can see it's kind of a mirror image, but you can tell the left side because the myocardium, the walls of that ventricle, are super thick compared to on the right side. So if we want to trace the flow of blood through the heart, it comes into the right into the right atrium. So here's the superior vena cava coming into the right atrium right there. It goes through a valve. This is the tricuspid valve. You can see that right there. That's held in place by these little strings. These are called chordae tendineae. And the valves on both sides of the heart have those. So here's the chordae tendineae on the left side of the heart. It goes into the right ventricle. And from the right ventricle, it goes out through the pulmonary artery. You can put your fingers in and touch right there. So it's coming up through this pulmonary artery and out to the lungs. Comes back from the lungs through the pulmonary veins and goes into, so here's pulmonary vein opening right here, goes into the left atrium. So there are the left atrium, or is the left atrium right there, goes through the bicuspid or mitral valve on that side. Again, see the chordae tendinate, you can see how this muscle gets pulled up a little bit where those are attached. That's the papillary muscle, and into the left ventricle. From the left ventricle, it's going to go out through the aorta. So you can see right here how that would be pumped up and then out to the rest of the body.